Chicago points to record COVID numbers as a reason to shut down indoor dining. Still, some of Chicago's most popular restaurants say they're not the source of the spread, and now they have some evidence to back it up. CBS News' Marissa Parra live in Fulton Market. Marissa, restaurant owners are fighting to survive.
Brad, we went to a health expert and we also went to those restaurant owners, and obviously they have a vested interest in this because they say this latest round of indoor restrictions could be the final nail on the coffin.
I'm looking at probably closing my restaurant if indoor dining isn't restored to at least 25%.
These restaurant owners say they've waited 40 days for city data on indoor dining and COVID-19. And now that they have their hands on it, they're even more frustrated.
Only 585 people out of 18,000 reported that they had visited a restaurant within 14 days of feeling sick. They were only able to contact, trace, or interview 8,009 of those people. And I got the form here, can you email? That's 44.6%. We need 100%.
Those tents and dining bubbles you see in places like Fulton Market, while flashy, aren't sustainable.
The vast majority of restaurants in our city, they can't put tents outside. They don't have the money. They don't have the space.
I'm good. How are you doing?
The governor ordered indoor dining rooms to shut down again after showing higher case numbers for those who visit bars and restaurants. We went to an expert from Northwestern to get her take. Beth Redbird looks at GPS data from phones. Her team is tracking the places people around the country are going in hopes they can predict where people are getting infected.
About 10% of points of interest, places people go, account for about 80% of infections.
According to their research, those points of interest are places like gyms, grocery stores, places of worship, and restaurants.
Reducing occupancy to 20% of maximum at a place like, say, a restaurant can decrease infections by 80%.
She adds that her research shows that reducing occupancy in tandem with mask wearing and ventilation could show big results keeping businesses afloat.
We find is that reducing occupancy at any place, particularly densely packed places, can be really effective in reducing spread.
Now, this just in from the Chicago Department of Public Health. They just got back to us. They actually cite that study from that Northwestern professor and her teammates. They say, and they cite in that study, that if restaurants had been reopened at full capacity at the start of the pandemic, that would have meant 600,000 new infections, and also that is 3 times the amount of other places like gyms or stores. We're live from Fulton Market. Marissa Parra, CBS 2 News.